Well, thanks for sticking around. The Workbench segment, everyone's favorite. I'm here to introduce some very novel devices from a very specialized wound care company. With me today from Spectrum is Chris Allerton. Hello, Chris.
Hey, Dr. Nisgoda. Pleasure to be here.
Thanks for joining us on the Wound Wire.
Anytime.
And the Workbench segment, one of everyone's favorites.
Sure.
Well, listen, we've got some very interesting devices here. Tell us a little about Spectrum and what the devices and what you offer.
Sure. Spectrum Healthcare is a company that was founded 7 years ago. It is based on the principle that compression therapy products and service go hand in hand.
Okay, good.
What we like to do is offer many different products.
Right.
We're a distributor. We're not a manufacturer.
Okay.
So as a distributor, we have different products. Let me point out just a couple that we have. Biocompression systems, Waypoint Medical, which is another pump, Lymphopress, which is another pump. Basically, whatever pump you need, we get it for you.
Fabulous, Chris. And I understand you take these and deliver them right to the patient's doorstep, into the home.
If you notice on our website and our brochures, service first.
Fabulous. Well, as you know, Chris, I'm a strong advocate of these compression pumps. We use them extensively in our clinic. And we're going to share with the viewers today an actual clinical segment. Are you ready to go to the clinic and talk about these devices?
Can't wait.
Let's go. We'll see you in the clinic.
All right.
Mr. Hitz, we just did your dressing change. The progress has not been exactly what I was hoping for. It's a little slower. We're doing everything that I think we should be doing. We're looking at controlling bioburden, bacteria on the wound. We're giving you compression therapy with these wraps. You've been coming in, twice a week for these changes. We're just not making the pressure. I'm going to ask for Dr. Simonotic's opinion. See if I'm missing something here. Just see what his thoughts are. Can you spare a few more minutes?
Yeah.
Okay. Carol, would you go find Dr. Simonotic for me?
Okay. All right. I'll give him Crystal. All right. Talk to you later. Bye.
All right, Dr. Nisgoda wants you to see a patient.
Ah.
What's your opinion?
Okay. Cameras and everything.
Okay, I have Dr. Simonotic.
Jack, how you doing?
You remember Mr. Hitz?
Yeah,
that's fine. We've been struggling with venous insufficiency ulcers for a while now. I think we've done a good job of providing compression therapies, and a Pro4 dressing's been in that for a while. We've addressed bioburden, arterial flow. We've done the basic, provided a good moisture, done serial debridements. We're making progress, but not really the kind of progress that I would like. I wanted just your thoughts. I mean, am I missing something here? What else could we be doing?
What are we doing for compression now?
He's in a full Pro4, twice a week to changes.
Compression pumps we could try.
Ah, that's a great idea. Have you ever been on home compression pumps?
No.
That's an excellent idea. What, you want to explain to him what we're thinking?
Sure. Sequential gradient compression is the technical name for it. Sequential meaning there's a series of balloons. There's this device that sort of slides on your leg. They're like bags. They're sleeves, fabric sleeves, and they've got a series of balloons built into them. Usually, well, in your case, probably we'll do both legs. And that connects with some hoses, usually pretty simple, to a machine. Usually sits at your bedside or next to your sofa, wherever you're going to do it. And you just connect it up. You pull them on, and they just inflate, going from the foot upwards.
And sort of massage your leg, sort of take the fluid in the lower extremity and sort of milk it up by these compressing your legs sequentially up. The fluid goes back to your body, returns to your body, and the kidneys get rid of it. That's a great idea. And typically twice a day?
Usually. I like to, or goal for twice a day. Sometimes start less and work up to it. And I try to get them an hour. Try to get them a goal of being an hour twice.
Yeah. We've really had good results with this in the home setting. In fact, some patients even come off of compressions.
Right. That's one of the big benefits. You want
Ooh, that would be nice.
no guarantees. No guarantee.
Try.
You want to give it a shot?
I'll try anything right
So what we'll do is Carolyn will go out and get the paperwork. We'll fax it off to the company. You'll hear from the company. We're going to use Spectrum. The company has been very good to us. Great customer service, great patient relationship, and they got a great device. They'll contact you, go through the insurance issues, take care of all that. Come to your home, fit you with it, show it how to use it, and then we'll just see you here back in follow-up.
Okay.
Yeah.
Fabulous.
Usually works really well.
Great, Carolyn, fabulous. Oh, absolutely, Carolyn provided you with a little brochure from the company, and that'll give you some information.
All right.
And you'll hear from Spectrum. So, and then let's see you back in a couple weeks again.
Okay, thanks.
All right, very good. Thanks for.
Take care.
All right.
All right.
After writing up the order, Carolyn notifies Spectrum and faxes it over to their offices.
Great, yes, we're the company that's going to provide that.
Chris receives the order and goes directly to the patient's home. The wound wire recently followed Chris on his initial visit to demonstrate and set up a Spectrum compression pump.
Hey, how are you?
Yeah, hi, how are you?
Great. This looks like a very nice place to do
Yes,
it.
this is my couch. Watch TV or read. Very
Perfect.
comfy.
You definitely want to make sure you're comfortable when you use it. Okay, so I'm going to explain to you what you're seeing as I take everything out of the box. These are the 2 leg sleeves. Okay, we're doing both legs. And this is the compression pump. So the compression pump, as you see, is very small. It's very light. So what we have here is the leg sleeve, as you can see. We're going to slide this on this foot. And you want to make sure you pull it up. You have these straps here that you can pull up. You want to make. And we'll do the second one. Let's pull it up. Great. Always make sure your heels in the heel. So what we do is we take these and we connect them.
Yep.
So once we do that, that's on. This needle fluctuates up and down. Okay, so all we got to do is make sure that this needle goes to 50 when it starts. So you can see what it's doing is it's filling up every chamber. There's 8 chambers, goes 1 through 8. It's gradient sequential. So what happens is every 35 seconds it goes up the leg, and then 5 seconds of downtime, and it starts up again.
Really, very nice.
Yeah, and what's going to happen is it does take a couple minutes for it to warm up. There will be these sleeves will be completely inflated with air. So in a couple minutes you're going to look like moon boots. What it's doing is it's mimicking a massage. Okay, it is starting obviously at your toes,
Great.
and it works its way up the sleeve, and then it deflates again. So how's it feel so far?
It feels great.
Yeah.
Really comfy.
So as you can see, they're fully inflated. Now when you're done with this, all you're going to do is you're going to turn the button off, which is the on-off button. See, I can turn it off at any moment.
Great.
It's not like it's,
uh-huh.
yeah, you can turn it off at any time. So if I turn this off right now,
That's
the light will
great.
stay on until the air comes out of the sleeves. And all we have to do is let it out.
Simple enough.
Just
Very
like that.
good.
Yeah.
That
So
was
all these,
great.
you don't have to take anything off. Everything's ready to go the next time you
great.
use it.
That's great.
Do you have any other questions for me?
No, I think so. I think you answered them all, and
All right,
I think
perfect.
it'll be easy to work.
All right, we just have some paperwork that we'll have you sign, and then I'll get out of here, all right?
Very good.
All right.
Well, I hope you enjoyed that clinical segment. As you can see, I use these compression devices in the clinical practice nearly on a daily basis with some very outstanding results. Chris, I want to thank you and Spectrum for coming in and sponsoring the Workbench for us.
Sure.
And if our viewers are interested in accessing Spectrum or any of these devices, how do they get a hold of you?
They can either contact us at spectrumhealthcare.net, go on our
Okay.
website, they can call us, all the information on all these products is there. And if they call us anytime, we answer the phone. We're ready to talk to anybody at any time, answer any questions.
Very good.
All right?
Thank you again,
Thanks,
sir.
Dr. Escoda. Appreciate it.
Thanks for staying with us.